Magnetic tattoo removal, the latest boutique method of removing a tattoo. It states that it's more dependable than laser tattoo removal, that it's non-invasive, pain-free, can remove every color, and is useful on every skin type. They say there's really no risk of scarring or skin discoloration. Hi, I'm Dr. Messina, president of Dr. Undo Tattoo Limited, and I've been involved in laser tattoo removal since 2005. Today we're going to be reviewing magnetic tattoo removal in depth, and we're going to find out if it's truly going to revolutionize the tattoo removal industry, or is it going to be another product that made grandiose promises that weren't fulfilled and only ended up disappearing in the next couple of months. It's important to know that I'm not discussing any one company in particular. Magnetic tattoo removal is completely based on the fact that a small number of inks might have metallic particles in their mixture, and these metallic particles would be affected by a magnetic field. The way they generate a magnetic field is they have a handheld device. It looks and sounds very much like a tattoo machine, but it's not. Instead of having sharp needles, it has a series of blunt-tipped needles that is sterile and magnetized. They're placed on the skin above the tattoo, and then with a little bit of pressure, rubbed back and forth, eventually scraping off the stratum corneum and the keratinized layer of dead cells on the surface of the skin. Once that occurs, you start adding these serums. The theory being the serums will seek out the metallic particles of the ink, which is residing deep into your dermis, and help loosen up that ink. They also state that the ink is further loosened by heat generated with this constant motion of the device, increasing the rate of evaporation of water around the tattoo. Then the serums help bring the ink particles closer to the device, which grabs it in its magnetic field and pulls it out of the skin. So now let's break down this entire process. First of all, their first two promises go right out the window. It is invasive and it is painful. If you look at real self-reviews, almost all of the people stated that it was very uncomfortable. Furthermore, not every ink contains metallic particles. And when asked about that, the company said, oh, no problem, these devices will remove that ink too, which makes no sense, because either you're attracting metallic ink particles into your magnetic field or you're not. And if ink is truly coming out of the skin in a non-metallic ink, then it has to be one thing, that the device is getting to the dermis and manually extracting the ink from the dermis, which is very dangerous. It's a good way to create a scar, and God forbid it gets infected and damages your dermis, you could have healing issues. But we don't know what's happening at the dermal level, because studies haven't been done to prove what's happening. You see, when they had fractionated CO2 lasers, after a treatment, they took a skin biopsy, and you could see a clear, sharp wound into the dermis. They don't do that with this. I'd imagine if someone did, you might see the dermis to have abrasions all over it in a very uncontrolled fashion. So I'm a bit concerned about that it's manually pulling ink out of the dermis, and it is not as non-invasive as they state. Now let's look at the serums. Some of the companies say what's in the serums. Others don't. But most of them seem to be the same thing. They have some kind of metallic oxide in there, be it zinc or magnesium. But some of them have triethanolamine in there. And that triethanolamine is a proven carcinogen in fish and other animals. And it's not recommended to be placed on the skin at all. But we are going beyond skin placement here. We're actually having these serums go down to the dermis. And that triethanolamine is a potential carcinogen. Also, anytime you have a serum entering the skin, you always run the risk of developing hypersensitivities, allergic reactions, contact dermatitis, and at worst, granuloma formation. We've seen that in people who've gotten vitamin C antioxidants along with microneedling. They developed granulomas, which are thickened, firm chunks of tissue from an immune response, anywhere from 6 months to 2 years after the initial treatment. So we have to be worried about granuloma formation as well. It's stated that magnetic tattoo removal will remove every color of ink and is safe in every skin type. So let's look into that. Yes, I could clearly believe that it would remove every color because unlike laser tattoo removal, where we have to pair off the wavelength of light coming from the laser to the wavelength absorbed by the ink, in this case, we're just manually extracting the ink, so it doesn't matter what color it is. It's ink, it's sitting there, and it's being pulled out. But as far as being safe in every skin type, I strongly disagree. You see, we're putting this device on the same area and vigorously removing skin, manually scraping off skin. And they say that you're going to need at least 8 treatments, which means that exact area is going to be traumatized over and over and over again. If you're a person of color, the risk of developing pigmentary issues, both hyper and hypopigmentation, is great. So you might indeed lose that tattoo. I'm going to talk about that in a minute because I haven't really seen any great before and after pictures. And replace it with a patch of darker hyperpigmented skin. They also claim that it's 99% effective versus laser tattoo removal being 40% effective. I dispute both of those claims. First of all, they don't have the studies to show that it's actually 99% effective. And laser tattoo removal is more like 85% effective. There's about 25% of the population that is really not going to have their tattoo removed properly using laser therapy. So what's my take on the whole thing? Well, first, we have to understand that as a physician, I just can't recommend anything that my heart desires. I have an obligation to give out therapies that are proven and standards of care. However, I do have some real concerns. I'm concerned about the sterility of those needle tips. Are they going to be reused and become contaminated? I'm concerned about what's in those serums. Some serums don't even tell you what's in there, so you don't know what you're putting into your dermis. I'm also concerned about the efficacy. This has been around now for about 5 years from what I could see, and I didn't see any really outstanding before and after pictures. In almost every one, I was able to see either a pigment change or still see the ink. Sometimes it may have been just a slight ghosting of the ink. Other times the ink looked barely changed. So I would be concerned that you might be subjecting yourself to 8 or more therapies that simply aren't going to work. I would be very careful. I would be very careful about who you go to. I would be very careful about sterility. My gut feeling is if it was used on a specific area, such as the lip, where you might have a metallic cosmetic ink in there, in a thin tissue, it might remove that ink fairly quickly and fairly cleanly. But it will not be practical for a large tattoo. It takes way too much time. If you look at real self, people would say, even with my small tattoo, it still took 20 minutes for this procedure. Versus a small tattoo might take 20 seconds with the standard laser for tattoo removal. So will magnetic tattoo removal revolutionize the tattoo removal industry? I doubt it. Time will tell. We're going to need more reliable studies to see what happens. Now, personally, I hope that this revolutionizes the tattoo removal industry, because then I'll kick my $200,000 laser to the curb and its maintenance and buy these devices. I hope this sheds some light on the magnetic tattoo removal process, and you learned something from this. It might help you make a better decision for your removal process. If you do like these videos, remember to click subscribe, hit the little bell, and give me a thumbs up. and I'll put out more of these educational aesthetic medicine videos. Take care, and I'll see you at the next video.